story starts just 3 years after Röntgen discovered X-rays. The year was 1898, when the first X-ray machine was installed at the A.T. Still Infirmary of the American School of Osteopathy. David Littlejohn, M.D., Ph.D., joined the ASO staff to teach X-radiance. William Smith, M.D., who would eventually become a DO, conducted research with the new X-ray machine, and this led to the publication of Skiography and Circulation. A year later, Dr. Littlejohn published an article on X-ray burns. In 1902, Dr. A.B. Schaub published an article describing the need for physicians to specialize in the use of X-rays. In 1906, a postgraduate course in X-radiance was offered in Chicago at what would eventually become the Chicago College of Osteopathy and later Midwestern University. Then in 1913, Summerfield Still DO, a nephew of A.T. Still, began teaching X-radiance at ASO. In 1917, Earl Hoskins, who had also been involved in X-ray research at ASO, presented a paper on his research at the annual ASO convention. 4 years later, he would devise a weight-bearing X-ray examination. In 1918, Walter Thwaites, DO, who was formerly trained in Röntgenology at the St. Louis College of Physicians and Surgeons, took charge of the X-ray department at ASO. He would later start an X-ray equipment distributing business. Paul Lloyd, DO, in 1927 presented a paper on the first IV urogram at the AOA convention, in addition to a paper on a series of 75 ureteral salpingograms. An X-ray section of 25 members of the AOA was formed with Hubert Pocock, DO, as president, but he was unable to continue, such that Paul Lloyd, DO, took over the leadership and ascended to president. In California, a number of physicians with special training in X-ray were restricting their practices to that specialty. Herman Beckwith, DO, directed the X-ray service at the LA County Hospital in 1928. A year later, Floyd Trenery DO and Jack Frost DO joined Dr. Beckwith. In 1929, Dr. Trenery presented a paper on colloidal gold with radiation therapy in cancer. In 1930, Dr. Lloyd arranged a 2-day course for radiologists at the AOA convention. By 1937, Drs. Floyd Trenery, J.A. Porteous, Herman Beckwith, H.H. Martin, and R.C. McCaughan initiate serious discussions about a college of radiology. The AOA appointed a special committee to investigate certification of specialists, as it would be necessary to first have a certifying board prior to a specialty college. In 1938, Drs. Porteous, Lloyd, and Krause proceed to draft a constitution to form a college of radiologists. Questions that arose included whether all members should be immediate fellows. Should membership also include those who were simply owners of X-ray equipment, even when they did not devote significant time to the specialty of radiology? Should there be a prerequisite examination? At the AOA annual meeting held in Dallas, discussion of an examining board took place. Dr. Trenery was adamant that the certification examination should be held solely under the auspices of the specialty concerned. So what was the practice of radiology by these early pioneers like? Here are some comments by some who would become founders of the AOCR.
Protection of the door has been overlooked. Directly across from us was the laboratory, and at certain times we treated patients with a horizontal beam, and the beam was directed across the hall at the laboratory, because the personnel in there were a long way off, but still I'm sure that they did get some radiation.
Utilizing the erect standing film was to due entirely to his interest in the posture of man, what he does to his body when he sits, when he walks, when he stands, quietly or whatnot. With good reason. Go back in history, there's such things as back in the second decade, at least, I think it's right, the debutante slouch, for example. Or the attitude of men standing, keeping with one leg lower than the other.
Our day consisted of his talking to us, just taking all the time in the world to get the reports done, because he said it's more important to do one case well than to do 10 hurriedly and maybe miss something.
On June 30th, 1939, the AOA established the American Osteopathic Board of Radiology, which was the first specialty board in the osteopathic profession. Drs. Lloyd, Trenery, and Tedrick were appointed to organize the American Osteopathic Board of Radiology. The first examinations of the AOBR were held in St. Louis and Philadelphia in 1940. Candidates were tested in electricity, radiology physics, Röntgen ray therapy, radium therapy, diagnosis of tumors, film interpretation, and radiobiology. Among those examined were Drs. Trenery, Lloyd, KARIBO, Pettipies, Wheeler, and Krause. 11 certificates were issued. The teachers tested the students, and the students tested the teachers. By 1943, 1 year of internship and 1 year of specialty training was required as a prerequisite for board examination. Meanwhile, Drs. Porteous and Krause intensified efforts to form a college. In 1941, the American Osteopathic College of Radiology convened at Detroit Osteopathic Hospital with a newly certified radiologist. 9 founding members attended, including Drs. Trenery, Cash, Krause, Duff, KARIBO, Hendrickson, Fitch, Whithone, and Pettipies. Dr. Hobbs attended as an observer. Dr. Lloyd was elected president and Dr. KARIBO vice president of the newly formed AOCR. In 1942, the second meeting of the AOCR was poorly attended because of World War II. Dr. Trenery presented his paper on the physics of X-ray dosage. In 1943, 33 attended the AOCR meeting in Philadelphia. Upon the death of Dr. Trenery, Byron Cash DO wrote, "His loss is irreplaceable, but his memory shall forever be a beacon light for greater efforts and attainments in the field of osteopathic radiology." In 1944, the Constitution and bylaws of the AOCR were introduced to the AOA. They were accepted in principle by the AOA, but it would not be until 1948 before there was final approval with stipulation that the AOCR would be affiliated with the AOA. It was at that point that the AOCR finally became an officially recognized specialty college. A committee of Drs. Wheeler, Lloyd, and Tannenbaum was appointed in 1949 to design the Trenery Medal. Bertram Lobier, MD, a nuclear medicist, was the first to be awarded the Trenery Medal that year. Throughout the 1940s and 1950s, many hospital radiology departments were serviced by incompletely trained, uncertified DOs. A preceptorship program was started in order to give some supportive training. In 1954, the AOCR reviewed training programs of preceptorships versus 3-year residency. A motion was passed to recommend that only those who had completed a 3-year residency under an AOBR certified radiologist could be examined for specialty certification. Preceptorship training ended. The AOCR also recommended to the AOBR that a person must maintain a practice of at least 70% radiology in order to continue to be certified. professional education was a primary focus of the AOCR. In 1947, the Education Committee presented a plan for the initiation of an annual mid-year course. In 1948, Drs. Eugene Krause and Kenneth Wheeler developed a plan for an annual program. In 1947, the AOCR began holding annual meetings with the newly formed Annual Clinical Assembly of the American College of Osteopathic Surgeons. This was joined in 1948 by the American Osteopathic College of Anesthesiologists and in 1949 by the American Osteopathic Academy of Orthopedics. In 1953, William Tannenbaum DO was invited into full membership in the International Congress of Radiology. This helped to give considerable credibility to the AOCR. In 1954, the Committee on Evaluation and Educational Standards, or E²S, was initiated to review and enhance radiology training programs within the AOCR. First chairman was Floyd Trenery DO. Throughout the 1960s were years of growth for the AOCR. The budget was in the black, a manual of procedure had been approved, an active professional bureau had been established to help radiologists in finding positions, and a standard of conduct was adopted to govern such relocations. In 1973, the View Box was initiated under the leadership of President Fred Wilkins, DO, in order to keep members informed of inner workings of the AOCR's various committee activities and its board of directors.
I'm Martin Landis, was president in 1975-1976, and one of the big things that happened in my first couple months was a suit by the Attorney General of Arizona, and I happened to have a good attorney who was able to set it up so we had somebody that could go out and represent the college and get a plea for a settlement rather than for going to court. So he claimed that we were price fixing because we were all charging the same for the same type of work as American College of Radiology had outlined.
I'm David Kellam. I was president of the American Osteopathic College of Radiology from 1976 to 1977. Point out that I trained under the late, well-known Dr. Charles J. KARIBO as a resident in radiology at the Detroit Osteopathic Hospital. The Senator Tillman of Georgia had decided in his infinite wisdom that all radiologists, as well as pathologists and anesthesiologists, should all be placed upon a salary rather than a percentage at which time a lot of radiologists worked under. And as a result of that, the American College of Radiology, as well as the AOCR, embarked upon the idea of separate billing. We were concerned, obviously, being involved on a salary by hospitals through a bill by the federal government. As a matter of fact, anesthesiologists, pathologists involved, we called it RAP. And then the idea of having cardiologists involved, it was called CRAP. That always brings a smile to my lips, and that was the time when I was to present Dr. Arthur Simon the oath of office before a very formal, at that time, tuxedoed head table, and the members of the college who weren't at the head table were to wear tuxedos, as well as members of the American Osteopathic Board of Radiology. The old guard, if you will, still had the rigid rules of formality. So we sat at the head table, and to my horror, I realized approximately 5 minutes before I was to present the oath of office to Dr. Simon, I had forgotten that very oath of office I was to recite before Dr. Simon in front of this huge audience. Now, mind you, Dr. Simon and I had rehearsed this that afternoon. So Dr. Simon was well aware, he thought, of what he was going to receive from my lips, rendering the oath of office. I said to Dolores, who was sitting next to me at the head table, I said, "Good Lord, I forgot and left in my room the oath of office. I don't know what I can do. I don't have the time to run up to the room to get that oath of office." Very unsympathetic, Dolores said to me, "You'll think of something." So within due time, that next 5 minutes, I was called before the podium to present Dr. Simon with the oath of office. I had no clue as to what I was going to say. I got before Dr. Simon and had him raise his right hand and began to recite anything that ranged from the Boy Scout of Honor to the Pledge of Allegiance of the American flag to whatever I could muster in an ad-lib fashion. What was amazing about this is Dr. Simon was hearing words with which he was completely knowledgeable. His eyeballs bugged out like saucer pans. He was in shock. But Dr. Simon immediately regained his composure and muttered through that combination of the Pledge of Allegiance of the flag, the Boy Scouts of America, and whatever else I came up with. Well, you can imagine those members of the old guard in the audience who probably knew that oath of office by pure memory must have been shocked. And I rather suspect that that was one of the initiating factors to change some of the formats to our formal annual dinners that we once held in a very formal fashion.
I am Joseph Andrews. I was the president of the college in 1978 and 1979. At the time I took over presidency, we were kind of helter-skelter as far as our organization is concerned. Each physician that had an office was running it out of his office. There was no central point at which any member of the college could pick up the phone, call. They would speak to me. I would refer them to somebody on East Square S or this and that. And it just was a very poor system. We had grown enough that we really needed someone as a central figure and someone that could collate and take care of these things. As a result, through our meetings, and we discussed this over a period of a year or two, and finally when I became president, I gave the nod to Mike Williams, who really did an excellent job. And he obtained Pam Smith, brought her in for an interview, and subsequently, of course, we hired her, and the rest is history. She did a superb job.
There were two epic years for our organization. One was 1978 in the College of Radiology, Osteopathic College of Radiology, and the second one was 1988 in the American Osteopathic Board of Radiology. And the reason I say that is because in 1978, the college was blessed by hiring Pam Smith. Pam was a secretary at KCOM, Kirksville College of Osteopathic Medicine, and worked in the president's office, and I got to know her. And when I was instructed to hire a secretary, I went to Pam because she was also the president of the secretaries of Northeast Missouri. And so I talked to her about it, and within 24 hours she came back and said, "I found somebody." And I said, "Who?" And she said, "Me." And I said, "Oh, I'm going to take the president's secretary?" She says, "Well, I'd like to have the job." And I says, "Well, it's all right with me, you know, if it's all right with you." The rest is history. And in 1978, she and I, with my knowledge of the college and the organization of it, which dated back to 1941, it needed to be changed. It needed to be updated severely. Pam is blessed with incredible talent of organization. And by me standing next to her and explaining the radiology part of it, she was able to reorganize the college and update it. And within, I'd say, 2 to 3 years, we were right up to date with any organization. The second one was 1988. After I served my term as president and past president, I was called by Joe Andrews, who was then the chairman of the American Osteopathic Board of Radiology, and he said, "We need to update the board too." So Pam and I were appointed to the board. I became the secretary and she was the executive director of the Board of Radiology. And we went through an enormous change on the board, enormous, to the point where I, as I said earlier, I went to the ABR, the American Board of Radiology, learned a lot of things from them, brought it back, and then she and I sat down and totally reorganized the Board of Radiology. Everybody knows Pam, everybody knows what she's done, but you know, I was there watching this talent unfold, which was a tremendous benefit for both organizations, the college and the board.
Hi, I'm Pam Smith. I have been the Executive Director with the American Osteopathic College of Radiology since 1978. It's given me such an opportunity. I can't begin to thank you enough for that. I've been able to travel. I've been able to take my family on some of the trips. I have met the most wonderful people, radiologists and other specialists, but mostly radiologists. I do think they have a special personality. It's amazing the things that we did and the opportunity to travel with them to represent the AOCR. And I will have to say that I feel like the AOCR is one of the most respected colleges in our profession.
I'm George Fairber, DO. I was president of the AOCR in 1981 to 82. It was actually the 40th anniversary year of AOCR. Rapport kept improving between the DOs and MDs incrementally, like the glacier advanced slowly. But we were accepted as one of the society members of the Inter-Society group, which included the ACR and other radiologic organizations. And I was actually the representative of the college to the Federated Council of Nuclear Medicine Organizations, who had a lot to do with accepting or recommending the standards to the NRC.
Throughout this period of the 80s to 90s, dramatic technological changes in radiology were occurring with ultrasound, CT, nuclear medicine, and MRI. In 1982, the Nuclear Regulatory Committee accepted the AOBR certification for licensure. Minimal standards in radiology residencies were increased from 3 to 6 months in nuclear medicine. In 1983, relations with MDs continued to improve. President Fred Katz DO addressed the Board of Chancellors of the ACR on the topic of what is a DO. This helped to increase the understanding and respect of DO radiologists among their allopathic peers. The Joint Commission on Accreditation announced that certification by the AOBR is equivalent to certification by the ABR.
I remember one time, well, we were in Washington, D.C. at the Black Caucus, and we were opening up these bottles, you know, and having our party. Well, the next day we had meetings, and Dr. Williams, my partner, who was treasurer at that time, and I had to go to the meeting. So at that time, everybody wore suits, you know, and ties. You know, when I went to a meeting, I probably took 4 or 5 suits with me, and today, you know, I take 4 or 5 shirts with me. But at that time, we wore suits. So we had our suits on. And we were on like floor number 23, and the door opens, and I get on the elevator with Paul, and there's nobody on there. Well, we get down to like floor number 16, and the door opens, and there standing in front of me is Joe Lewis. He was there for the Black Caucus, and he gets on with these very attractive ladies, and I'm standing there, and I thought, that's Joe Lewis. So I nudge Paul, my partner. I says, Paul, you know, as loud as this, that's Joe Lewis. and Joe turns around and he smiles at me, and the other ladies smile. And I said, can I shake your hand? He says, absolutely. So I shook his hand, and Joe Lewis and I had kind of a similar thing in our lives. We both worked at Ford Motor Company foundry. He worked there when before he won the world championship in boxing, and I worked there before I became a doctor. So we had a common background, and I'll never forget that. In Florida, we were at a meeting one time, and we decided to go swimming in the ocean. And so we changed into our bathing suits, and Pam and Paul and me and my wife and other people, we went down to the beach, and we were laying there, and we went out into the ocean, and I was standing there, and all of a sudden I looked around and the ocean changed color. I thought, what in the world is going on? And I looked down, and there were all these little fish around me, and they were mullet. And I looked up, and that's a shark fin over there. And so I told Jen, I said, let's get out. She said, well, go ahead. And so I got out, and I'm standing on the beach looking at this change in the color of the water, and there was a shark out there that was feeding on the mullet. And a guy came up to me, and he says, I see that you got out of the ocean. I said, yeah, I think there's a shark. He said, that's a shark. He's feeding on the mullet. He says, you don't really have to worry about the shark. He said that unless you get in the way, they're not gonna bite you.
I'm Sam Jasnoff. I served as president of the AOCR from 1989 through 1990. The specialty colleges in the House of Delegates of the AOA, the specialty colleges were non-members and were not invited to participate in the House of Delegates at that point in time. I started a drive to get the specialty colleges to become voting members of the House of Delegates at AOA. Enormous battles, enormous fights, and one of them even led to my threatened expulsion from the profession by some AOA people as a result of it. The point being that the AOA was making rules for the colleges. The colleges had a right to express their opinions and put their input into it. The AOA's position was if they allow that, then the colleges might take over the House of Delegates. And the answer was simple. At one vote per college, maybe it was 10 colleges, there's no way we're going to outvote anybody or anything. But you needed us, they need to hear our voice. Whatever the issue is, they need to hear our opinion. And that was the beginning. That opened up. It happened the year after mine, but that opened up so that the specialty colleges became active members in the House of Delegates.
My name is Lisa Loxo, and 24 years ago I was the president of the AOCR. 1991 was the year that was the 50th anniversary for the AOCR, and I had an opportunity to help the planning of the celebration, and it was an amazing celebration.
Hi, I'm Richard Lynch. I was president of the AOCR in 1991 and president of the American Osteopathic Board of Radiology in the year 2000. Some of the challenges I had were the fact that practicing radiologists were having difficulties with getting approval because of HMOs had just begun, so we started that's when we got the idea of the recertification exam, started in 1991.
My name is Paul Chase. I was the 51st president of the American Osteopathic College of Radiology. President, my goals were to have every single person in the college involved in the college in some way. Standing events during my presidency that I remember was the mid-year meeting at Stan Briney's Ranch. Everybody got to ride the big Longhorns, and we had a country singer, we had a great barbecue.
Well, the challenges that were developed in our college at that time was we were losing the support of the Kodaks of the world and the DuPonts because things were changing in radiology. Films were no longer to be utilized, we were going to the digital age, and as such, we had to look for other sources of revenue to continue the programs. Fortunately, through many members of the college, we went on and attempted to stress postgraduate education. And our programs for the college have continued to expand, and we were able to bring in top name speakers, both on the allopathic as well as our osteopathic programs.
I'm Abe Para. I was president in 1998, 1999. Our challenges always were to maintain our independence from the AOA, although we were part of the AOA, and just to make sure that we did have the ability to have independent decision-making process for whatever we could. To balance that was to affiliate as closely with the ACR as we could, because the ACR basically were our comrades in our specialty, and the idea was to increase our association with them to improve our educational abilities and viability of our organization.
I'm Denzel Hawes Davis, and I was president of the AOCR from late 1999 to the fall of 2000. During that time, it was our feelings that our residencies, many were being utilized for doing the work in the department rather than receiving quality education. We attempted in multiple ways to improve this through having some resident lectures at the annual meetings or mid-year meetings. However, we really felt that it really boiled down to the program chairmen themselves at the different institutions. So we tried to have programs at these meetings for the program chairmen to try and help them give the residents better education. The programs were somewhat resistant to change, and those that were resistant to change we eventually closed and helped the residents find another program.
In 1999, the AOCR's first website was launched. In 2002, William Shields DO was instrumental in starting the AOCR Distant Learning Lectures. Starting with 6 lectures per year, they have increased to 9 lectures per year currently. William Shields DO, the 59th president of the AOCR, shares his recollections.
I'm Bill Shields, and I was the president of the AOCR 2004 to 2005. When I became president, some of my own personal goals were very much focused on resident education and making sure that we were producing a product for the residents that was going to entice the residents to A, feel nurtured and cared for, as well as meeting their needs so that they would want to become future members of the AOCR as faculty. Another goal was leadership development and identifying people like yourself who had the potential to lead, and leadership development, identifying future leaders was a key part of my agenda as the AOCR president.
Bruno Bourne, DO, from Livonia, Michigan, and past president of the AOCR from 2005 to 2007. My goals as president of the AOCR primarily were to turn over a lot of the leadership, to bring in a lot of the younger individuals, or new individuals, not necessarily younger, but new individuals into the college committee level, and so that the board and the committees would have fresh ideas, some newer perspectives.
Michael Cawthon, and I was the AOCR president from 2007 to 2009, and getting a strategic planning process embedded within the college's activities.
And I was president of the AOCR from 2009 to 2012. And that seems like a long time. They changed the annual meeting time, so that's why there was some additional overlap there. During my presidency, some of my biggest challenges were implementation of the strategic plan that the AOCR had worked on for 18 to 24 months, where they surveyed all the members, tried to congeal all that information, and where do we need to go as an organization based upon membership input. And that was one of the first times that had been done, and I think in the osteopathic profession we were the first to do that. Okay, so that was a big deal, and I thought it was really good for us, and I think we're reaping some of the benefits of that now, being very in touch with our members. Education was a big goal, and trying to make sure our residencies were second to none, and that our CME for our members was second to none, and obviously you're seeing that now.
I'm Frederick E. White, DO. I'm a fellow in the American Osteopathic College of Radiology, and I've been privileged to be president of the AOCR from 2012 through 2014. The biggest challenges in my time as president have to be what's going on in America. The change in the governmental involvement in America into medicine is a great challenge, and therefore it trickles down into radiology. Other challenges coming along is the single accreditation type process that we're going through. We're in the middle of that. There's been a memorandum of understanding towards that, and how it shakes out will be very interesting, but we are watching it very carefully and making sure that our osteopathic world is intact through this. During the presidency is trying to establish additional radiology residency programs.
I'm Rhonda Boehner. I'm in charge of the CME activities. So that we were the first osteopathic organization to be accredited to offer our programs to MDs. We have maintained that accreditation all through the years. So we are duly accredited AOA and ACCME.
Starting in 2003, the tradition of elegant formality of the awards ceremony was relaxed. Members now preferred a more casual format with a reception that followed mingling rather than highly formal sit-down banquet. Gone were the tuxedos and ball gowns. Here are some examples of recent awards events.
These contributions are recognized by conferring the title Fellow of the American Osteopathic College of Radiology. Will the candidates and their sponsors please approach the stage as your names are called? The candidates are Steve Min, sponsored by Michelle Walters, DO. Donna Moyer, DO, sponsored by Dave Kellam, DO, who unfortunately cannot be here tonight. Philip Orens, DO, sponsored by Sherry Albers, DO. Rocky Signs, DO, sponsored by Sherry Albers, DO. Steve Seidman, DO, sponsored by Dave Kellam, DO. At this time, I would like to ask Dr. Michelle Walters to approach the podium. I'd like to introduce your new president, Dr. Michelle Walters.